Habits and Health, episode 49.
Welcome to the Habits and Health podcast, where we believe creating healthy habits should be easy. Brought to you by an educator and coach for anyone who wants to create a healthier life. Here's your host, Tony Winyard.
Welcome to another edition of Habits and Health. My guest today, Dr. Sarah Myhill. She's a naturopathic physician, a former GP. She's written numerous books around chronic fatigue syndrome, ecological medicine, a book called The Infection Game, the Paleo Cookbook or the Paleo-Ketogenic Cookbook, the diagnosis and treatment of chronic fatigue syndrome and myalgic encephalitis, I can't even say that, and many others. We have a very interesting conversation, and, well, I don't need to say any more. Just listen to Dr. Sarah Myhill. Habits and Health. My guest today, Sarah Myhill. How are you, Sarah?
Very well, thank you, Tony. I'm looking forward to this morning.
And you're not so far away from me. You're in mid Wales, you were telling me.
Indeed, yeah, you're just down the road. If I'd known that before, I'd have trotted down and we could have done this live.
But your accent doesn't sound very Welsh.
Oh, I'm not Welsh. I mean, my family are North Londoners. We're brought up in Welwyn in Hertfordshire, and I only moved here, a few decades ago. And actually, the local people here are largely, well, they're all English speaking, and they have a Radnorshire accent rather than the Welsh accent.
For the people listening who maybe aren't familiar with your name, would you be able to give us a little background about what it is that you've done and what it is that you do now?
Okay. Well, I qualified in 1981, having been conventionally trained, at Middlesex Hospital Medical School. I then went straight into general practice, and I worked as an NHS GP for about 20 years. And during that time, I learned that modern medicine is not about identifying the root cause of symptoms. Modern medicine has drifted down the big pharma route, which is find a symptom and supply symptom-suppressing medication, which in the short term gives a short-term relief, but in the long term is disastrous. Because we have symptoms for very good reasons. Symptoms are the signpost. Symptoms tell us there's something wrong and you've got to do something about it. And if the symptom gets very nasty, when you don't do anything about it, then you should work even harder. And trying to tackle medicine from that intellectual viewpoint within the NHS became increasingly difficult. And eventually, during the late 1990s, I got my wrists slapped because my prescribing budget was so low. And because my prescribing budget was so low, that made me a bad doctor.
Wow.
Now, obviously, I was treating people through diet and lifestyle changes. And then actually there were several issues, but the last straw was that I was told I would have to have hepatitis B vaccination if I were to be allowed to continue in NHS practice. And I'd seen so many patients who'd had serious illnesses and fatigue syndromes triggered by vaccination. I thought, that's it, I've got to do my own thing. So in 2000, I set up an independent medical practice. In fact, there's a bit of overlap with my NHS work, but by then I had enough work to make it viable. Now, it is my view that all information should be freely available. And at that point, I set up a website. And everything that I knew or had learned about medicine, I put up there. And that's where my problems really started. Because you would think that somebody who was open to questioning and wanted to make that information freely available to all, would be applauded by the powers that be. And I actually found that the reverse was true. And in 2001 came my first General Medical Council investigation. Now, there have never been any complaints from patients. All my patients are very happy with what I do. Every single complaint has come from other doctors, health authorities, or sometimes the GMC itself. And in consequence of all that, I am now the most investigated doctor in the history of the General Medical Council.
Wow.
Not because I've done any harm, but simply because the establishment and the powers that be do not like my approach to medicine. They do not like the fact that I am looking for disease causation rather than symptom suppression with drugs. So anybody listening into this has got to be thinking on, as obviously you are, Tony, has got to be thinking on those guidelines. We have symptoms. Why do we have those symptoms? What are the mechanisms of those symptoms? And what tools can we use to reverse that pathology? And that's what medicine should be all about. And in fact, if you think about it, that formula applies to any situation, whether it's agriculture, whether it's engineering, whether it's health services, it doesn't matter. We ask, what the problem is. We identify the mechanism by which that problem has arrived at, and then that gives us an obvious treatment. And I have no difficulty with that logical progression, as I hope you and your listeners will have no difficulty as well.
Well, and many of the experts and doctors who have been guests before you have some from integrative medicine and from functional medicine and many similar types of approaches. So, yeah, very much. And you, I know a couple of people that I've spoken to. You've also got some specialities. I know that you're renowned in, I think it was chronic fatigue syndrome. Indeed. And some other sort of conditions similar to that area. Indeed.
And chronic fatigue is the worst treated condition in the Western world. When in the 1980s, I remember reading that the acronym TATT, tired all the time, constituted 40% of GP consultations then. Of course, it's not 40% now because people have worked out that the doctors are no good at that. They just fudge the issue. Instead of asking the question, why is this person fatigued? They maybe do some basic tests to make sure there's no major pathology there. And then they dismiss the patient as being a hypochondriac. And I started to get interested in chronic fatigue syndromes and ME in the mid-1980s and throughout the 1990s because I saw, very fit, healthy people, sometimes Olympic athletes, sometimes English, British athletes performing to top level who developed this condition. And that told me it certainly was not hypochondriasis. When I moved to Wales in the 1990s, I started seeing many farmers with sheep dip flu, which essentially is a severe chronic fatigue syndrome induced by exposure to toxic chemicals. And I was really then asked the question, why, what's going on here? Why are these people pathologically fatigued? And then I started seeing Gulf War veterans, again, with a clinical picture of chronic fatigue syndrome. What happened in the Gulf that caused those patients to be, those fit, healthy young men to become, pathologically ill. I saw over 200 women with silicone breast implants, who presented with a similar clinical picture of chronic fatigue syndrome and inflammation. And of course, you can get so many clues from the history as what is going on here. But let's leap forward to the here and now, to the present day. What have I arrived at now? And essentially, the clinical picture of chronic fatigue syndrome is characterized by pathological fatigue, which causes physical fatigue and mental fatigue. In fact, these patients essentially, they have an early dementia. And patients with ME, they have pathological fatigue with poor energy delivery mechanisms and inflammation. So their bodies are inflamed for reasons of allergy, autoimmunity, or maybe chronic infection. So that's how I break it down. And the key point to remember about chronic fatigue syndrome and ME is they are not diagnoses, they are clinical pictures. They're groups of symptoms, and we have to ask the question why. We then have to break it down. So what makes fatigue pathological? What's the difference between normal fatigue? Because guess what? You and I, we're going to be tired at the end of the day, and we're going to have a good night's sleep, and tomorrow we should wake up feeling fine. So the difference between pathological fatigue and normal fatigue is the delay aspect. People who are pathologically fatigued, if they overdo things, they pay for it the next day. Now, that's a universal symptom. Steve Redgrave, after he'd won his 4th gold medal and had pushed himself to his limits, he would have had delayed fatigue. That, for him, was pathological. But when energy delivery mechanisms are so awful that you can't survive, you can't do your everyday stuff just staying alive without getting pathological fatigue, then you're in trouble. Now, the starting point to treat ME and chronic fatigue syndrome is to look at energy delivery mechanisms. And the analogy which I use is the car analogy. So for your car to go, you've got to have the right fuel in the tank, and that's all about diet and gut function. Yep. You've got to have the mitochondrial engine, and this is my special area of interest. And together with John McLaren Howard, we published 3 papers now on mitochondrial function in patients with fatigue syndromes. Then you have to have the thyroid accelerator pedal, and that determines how fast your mitochondria go, and the adrenal gearbox. And the adrenal glands, the adrenal gearbox allows us to gear up in response to stress. So, in response to doing a podcast like this, then, I have to have a few stress hormones functioning, flowing in order to allow me to perform so that I can inform and hopefully entertain at the same time. So that's the analogy that I use for my patients. And I like that analogy because I get it and my patients get it. And it always starts with diet. Now, diet is probably the most difficult thing that I ask people to do, but it's also the most important. Yeah. And if you don't get diet right, nothing else works. Right. And the problem with Western diets is that they are high in sugars and they are high in carbohydrates. Now, if you've got a perfect digestion, and young people do have much better digestions than us old fogies, if you have perfect digestion, that will go a long way to dealing with sugars and carbohydrates. But it's so overwhelming nowadays. And there's so much sugar and junk food and fast carbs and fruits and fruit juices pouring into our diets that it changes our gut function. Yep. Now, just to talk about normal gut function, the human gut it's almost unique in the mammal world because the upper gut should be a sterile, acidic, digesting gut, just like my little dog who's sitting next to me, just like her gut, for the businesses of absorbing, digesting and absorbing meat and fat. And then the lower gut, the large bowel, should be a vegetarian gut, just like my horse, for the purposes of fermenting vegetable fibre. Now, that gut layout allows us to eat a very wide variety of foods. And that's part of what has made humans so successful in the natural world, because I can consume vegetables, which my dog certainly couldn't cope with, and I can consume meat, which my horse certainly wouldn't deal with either. Now, I say the upper gut should be a sterile, acidic, digesting gut. Now, if you overwhelm that with sugars and carbohydrates, then the bacteria and the yeast move in and they ferment. And the upper gut becomes an upper fermenting gut. And I now know without a shadow of doubt that drives much pathology. It causes a huge number of problems. The first thing is if your upper gut is a fermenting gut, then it will be full of bacteria and it will be full of yeast that the body's not used to, and they produce toxins, they produce bacterial endotoxins, they produce fungal mycotoxins, and all of those poison the body. If you start to consume vitamins, minerals, and of course there are lots of natural vitamins, minerals in foods, then those microbes are in the front seat. They get first pick. So they take all the B vitamins and the essential fatty acids and the minerals for their own metabolism, i.e. you malabsorb those supplements. And I see so many people who have spent a fortune on supplements, but they've got an upper fermenting gut. They're just feeding the bugs. Potentially they're making the situation worse. And then those microbes, when they ferment, they produce more toxins. So if you've got a yeast in the upper gut and you eat some fruit, it will ferment that to alcohol. It's called the auto-brewery syndrome. It's not rocket science. And it's not just ethyl alcohol we get. We can produce methyl alcohol, propyl alcohol, butyl alcohol. We can produce D-lactate, hydrogen sulfide, ammoniacal compounds, a whole range of toxins, all of which poison the body. And the blood, the venous drainage of the gut goes straight to the liver, and the liver has to deal with that toxic load. And in dealing with that toxic load, it uses a massive amount of energy. One of the statistics I love to quote is at rest, the brain consumes 20% of our energy and the heart 7% of our energy at rest. The liver consumes 27%, i.e. the same amount of energy as the heart and the brain combined, just to deal with that toxic load. So as soon as you clean up the upper fermenting gut with a PK diet, and we'll talk about that, as soon as you clean that up, you make more energy available to the rest of the body. So and there's a third major issue here. At medical school, we are taught, yes, the gut is full of bacteria, or rather the lower fermenting gut is full of bacteria, and there they stay and don't cause any problems. Not true. We now know that gut is a bit leaky, and some of those microbes do get from the gut into the bloodstream. Now, a very good example of that is if you brush your teeth. If I took a blood test from somebody 2 minutes after they brushed their teeth, I would find dental bacteria in the bloodstream. And that, of course, is why people with heart lesions go to the dentist, are given antibiotics routinely to stop them getting infections of the heart valve. But these microbes from the upper fermenting gut also get into the bloodstream. Now, from an evolutionary perspective, these microbes are not familiar. They shouldn't be there. And the immune system sees these unfamiliar, foreign microbes floating around in the bloodstream and getting stuck in our joints and get stuck in our skin and getting stuck, in our connective tissue. And where those microbes get stuck, we get inflammation. And I'm now quite sure that many pathologies derive from allergy to microbes from the upper fermenting gut. Pathologies like temporal arteritis, polymyalgia rheumatica, fibromyalgia, chronic urticaria, intrinsic asthma, inflammatory bowel disease, arthritis, etc. So if people listening to this podcast, I'm quite sure, Tony, you do the Paleo-Ketogenic diet because you wouldn't dare admit otherwise. If people listening to this podcast do nothing other than move to paleo, i.e. no grains, no dairy, because they are not natural foods, Paleo-Ketogenic, i.e. very low carbohydrate diet, they will be doing themselves a huge favour because we now know that doing that diet, is the starting point to treat absolutely everything, and is also the starting point to prevent absolutely everything. So guess what? Am I going to wait till I get my dementia or my cancer or my heart disease before I start doing the PK diet? No, I'm going to do it now. And again, people ask me, why the PK diet, And the answer is because that's what primitive man's been eating for the past few hundreds of thousands of years. That is the natural diet. And our bodies and our guts and our brains have evolved, consuming those foods. So that's what we should be eating. I know I've talked far too long. Your problem, Tony, is going to be shutting me up. And I'm quite sure there are 1,000,001 questions that might pop out. So if you've got anything, please say so now before you lose me in the distance.
So, I mean, as you say, that brings so many different questions into my mind. And the obvious one being, so someone does change to a paleo-ketogenic diet. How long typically, I mean, this is a bit like asking how long is a piece of string, but how long would it take those symptoms to start to disappear and for the person to recover?
Remarkably quickly. A few weeks, you would see a difference.
Okay.
Now, the problem is that sugars and junk foods are addictive. And what happens when we give up an addiction? We get withdrawal symptoms. So, the caffeine addict giving up caffeine will initially feel weak and maybe headachy and a bit spaced out, but that will last a few days or a week or so, and then they will feel much better. It's the same for any addiction. And the key to this diet is to think of sugars and refined carbohydrates as an addiction. And if you're eating foods in an addictive way, then you have metabolic syndrome. You are fueling your bodies with sugars and carbohydrates, and that is the forerunner to diabetes, high blood pressure, cholesterol problems, heart disease, cancer, dementia, the whole shooting match. So once you have recognised that sugars are addictive, and it's very easy to do. If I take a dietary history from somebody, I recognise within the first few seconds what the problem is. And if they say, oh yes, for breakfast, so well, I have a glass of fruit juice, a bowl of muesli, toast, marmalade, all those things are sugars and carbohydrates. I immediately know. And what that means when they have that sort of breakfast is that mid-morning they're hungry, because that breakfast sends their blood sugar flying up, which of course is very dangerous to the body. High blood sugar. Sugar is sticky stuff. It's sticky in the hands. If I pick up sugar and put it in my hands, it's sticky. It's sticky in the bloodstream too. It sticks to things. And in sticking to things, it damages and denatures them. So high blood sugar sticks to arteries and damages them. It sticks to brain proteins and damages them. In fact, dementia is now being called type 3 diabetes. It's a sugar problem in the brain. It sticks to connective tissue and damages that too. We now know osteoporosis is part of sugar addiction. So it manifests in lots of ways. So the body cannot allow the blood sugar to run too high. So as soon as it comes up after that high-carb meal, insulin is poured out. How does insulin bring the blood sugar down? By shunting into fat. And therefore, people running on carbs tend to get fat very easily. The whole metabolic drive is to laying down fat. So then the blood sugar starts to come down. Now, if you're eating sugar all the time, the brain runs on sugar. As the blood sugar drops, the brain starts to panic. Oh, we're running out of fuel. It sends out the panic hormone. What's the panic hormone? Adrenaline. What's adrenaline do? Okay, it stimulates, fat burning. Initially, it brings blood sugars back up again. But adrenaline gives us high blood pressure. It makes us feel stressed, worried, anxious. If you get an adrenaline spike in the middle of the night, it stops you sleeping. And we know that loss of sleep is a major driver of all pathologies. If you don't get good quality sleep and the right hours, we know that's a risk factor for cancer, heart disease, and dementia. It's symptomatic of that adrenaline spike. So, and that adrenaline spike is a bit addictive, because suddenly you've got a bit of energy. Okay, it's temporary, it's ephemeral. We know it's not going to last, but it runs out at 11 o'clock, and then our sugar addict goes and has a sweet drink, cup of coffee, biscuits, bag of crisps, piece of fruit, whatever. Up comes the blood sugar again, and you're on that roller coaster. And to get off that roller coaster does take a few days of very low carbohydrate diet until the body is running on ketones, because ketones are the preferred fuel of mitochondria. That's how they function best on. And we know that from years of just experience. I was fascinated to read that the samurai warriors, before a battle, they will fast for 24 hours because they know they function much better and at a high level when they're running on ketones. They have far more stamina. The world record for the furthest distance run in 24 hours is held by a keto-adapted athlete, Mike Morton. And during those 24 hours, he ran 172 miles. It's almost inconceivable, isn't it? Some listeners may have heard of Dr. Ian Lane, GP down in the south, who's a type 1 diabetic. Now, he controls his diabetes with a ketogenic diet. All type 1 diabetics will need a little bit of insulin, but very, very little, and it's constant. Anyway, not last summer, but the summer before, he did a 5-day fast together with Matthew Pinsent and some other athletes. And during those 5 days, he ran 20 miles every day. So he ran from Winchester to Bristol. And during that time, his blood sugars were absolutely level. He didn't run out of any energy. Obviously, he lost some weight because he was burning fat, but he was absolutely fine. And so were the other 4 keto-adapted athletes at the end of that. It illustrates the point that we can achieve great things on ketones. In fact, that's how we function best running on ketones. Our brain works better, our bodies work better. And by doing that low sugar carbohydrate diet, we massively reduce the toxic load. We massively reduce the load from sugar and from all products of fermentation that we talked about earlier. And just by reducing that toxic load, your liver has less work to do and your mitochondria work much better. Again, I know I'm jumping ahead, and forgive me for jumping all over the place, but mitochondria, that's my special area of interest. Right. And I started to get interested in mitochondria in the 1990s. We learn about them at medical school, as I'm sure you did, as part of second MB. You've got to struggle through your biochemistry, and as part of that, you learn about mitochondria. And it's the sort of subject that you mug up the night before on chocolate biscuits and coffee. You regurgitate onto the examination page the next day and hope you've done enough to pass. And the reason you do that is because in the 1970s, when I learned all this stuff, I didn't know that it had any clinical application. In fact, we weren't taught that it had any clinical application whatsoever. Right. But by contrast now, mitochondria are now implicated in any pathology you care to mention. We know they go slow in heart failure. We know they go slow in dementia. We know they're implicating cancer. We know they're a central part of diabetes. So, mitochondria has suddenly become, the most important pathological unit talked about in the modern world. But in the 1990s, when I first started rethinking them, there was none of this stuff. Anyway, I was very lucky to work with the most brilliant biochemist in the world, Dr. John McLaren Howard, who was at Biolab Laboratories. And I put it to him that we needed a mitochondrial function test. That was the easy bit. The difficult bit was developing the test. And John really should be given the Nobel Prize for biochemistry for his brilliance. He developed a mitochondrial function test. And I started to apply this test to my patients who are not responding to the usual dietary interventions, micronutrient supplements, and all that stuff. And to cut a very, 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 very long story short, and 3 papers later, we demonstrated that those patients with chronic fatigue syndrome, or ME, who had the most fatigue, had the worst mitochondrial function, and vice versa. Right. It's almost a straight line graph when we looked at mitochondrial function against disability. And this was done blinded, so I saw the patients and worked out their energy score in conjunction with them. The blood test went to John McLaren Howard, and of course, the blood went to John McLaren Howard, and of course, he didn't know how fatigued those patients were. He just did the test. Mm-hmm. And then the results went to a third party to be number crunched, and finally the paper was published. Right. So it was a very powerful paper. And our third paper then looked at what happens when we put the correct those mitochondrial functions. And mitochondria, say the engines of your car, they can go slow for a number of reasons. They can go slow because you've got the wrong fuel in the tank. Well, we've addressed that because guess what? We put the right fuel in the tank, which are ketones. The mitochondria can go slow because they are deficient in some essential nutrient. Now, in parallel with the mitochondrial function test, we also did nutritional studies looking at levels of magnesium, vitamin B3, coenzyme Q10, and we found that common things were common. And there were 5 common deficiencies that came up time and time and time again. Magnesium, vitamin B3, acetyl L-carnitine, CoQ10, and D-ribose are the 5 nutrients that we use to replace the deficiencies. Mm-hmm. And then we found mitochondria could go slow because they were blocked by something. And guess what? A very common thing was products of the fermenting gut. And we've already addressed that with our PK diet. But again, this is starting to fit in with those people I'd seen who'd been poisoned. Because the Gulf War veterans were poisoned by organophosphates. Sheep dip farmers are poisoned by organophosphates. People experiencing spray drift are poisoned by organophosphates. The nasty bit of biochemistry that describes mitochondrial function is called oxidative phosphorylation. So no wonder that was inhibited by organophosphates. It's not rocket science, is it? So by identifying the toxins, and again, you get clues from the history, heavy metals, pesticides or whatever, we found we could improve mitochondrial function reliably well. So that's the second bit. And at that point, I felt qualified to write a book on it, which I called Chronic Fatigue Syndrome. It's mitochondria, not hypochondria. And I have to say that title went down very well with my fatigue patients. So then we have to look at the control mechanisms. Because, you could have, a Formula One car with rocket fuel in it. But if the accelerator pedal and the gearbox didn't work, you wouldn't go anywhere. Yeah. So the next thing we have to look at are the control mechanisms. Now, the underactive thyroid is probably one of the worst treated condition in Western medicine. Not my words, but the words of Dr. Kenneth Blanchard, American endocrinologist who's written several books on the subject. He estimates that maybe up to 40% of Westerners are deficient in thyroid hormones. We are seeing epidemics of hypothyroidism now. Even the conventional endocrinologists in this country will tell you, well, about 1% of the population receive thyroid hormones, but they know about 10% actually need treatment, and that diagnosis has been missed. So in my books, I took a lot about the characteristic symptoms of the underactive thyroid and how you can treat it yourself with natural interventions. The point here is you have to bypass doctors because doctors are a brake. They get in the way of treating the underactive thyroid well because they will only diagnose that on the basis of blood tests. And then often there's only one part of the blood test they look at, which is the TSH. If the TSH is normal, nothing wrong with you. Rubbish, rubbish, rubbish. So we then look at, say, the thyroid accelerator pedal. And then we concentrate on the adrenal gearbox that allows us to gear up in response to stress. And don't laugh now, my lovely publisher, Georgina, who, bless her, prints everything that I write, has asked me to do a thyroid adrenal book, and that is my next project. So I can send you the early chapters if you think that would help. But that's the overview of the patients with chronic fatigue syndrome. And then we have to look at the ME patients. And the ME patients, they've all got chronic fatigue syndrome. They've all got poor energy delivery mechanisms, but they've also got inflammation.
Right. And
inflammation occurs when the immune system is busy. Now, the immune system is obviously an essential part of our health. And what we want is an intelligent immune system that switches on in response to an acute infection, deals with that, busily and actively, and gets rid of that virus or bacteria or fungus, whatever it is, and then goes back to a dormant state again.
Yeah.
But so many of the MEs, the immune system has been switched on and hasn't been switched off. It continues in an inflamed state in response to a chronic infection that it has not dealt with, efficiently. The immune system can be switched on. And the analogy I like to use is the immune system is our standing army. Imagine the body is a country and the immune system is our standing army. Now, of course, we want to swing it into action when Napoleon invades. We want to sweep him off the beaches before he, gets to he gets to the Tower of London and grabs the crown jewels. So get rid of infection. But what we don't want is our standing army to start attacking harmless tourists, harmless tourists that might be doing some good, harmless tourists like food, like pollen, those things don't cause the body any harm whatsoever from an allergy point of view, and that is called allergy. So people reacting allergically to foods, that's stupidity, that's an immune error, that's a big mistake. And worse than that, you can get a case of what I call civil war, when our standing army attacks itself. And that's called autoimmunity. And that's, the immune system suddenly decides that the thyroid is an enemy and attacks it and destroys it. Suddenly decides that lining of the gut is an enemy and attacks it and destroys it. And autoimmunity is very bad news. And the big thing that switches on autoimmunity better than anything else is vaccination. And this is why it's so worrying at the moment that we're seeing, epidemics of vaccination, and we will see epidemics of autoimmunity that will follow that. We're in a very dangerous situation at present. Already autoimmunity afflicts about 1 in 20 of the population. That is far too high. Rates of autoimmunity are increasing exponentially. So those are the 3 categories of inflammation that I'm looking for in somebody who's got ME. Again, I've talked far too long. You're very nicely sitting there smiling at me as if I'm doing the right thing. But again, is it making sense? I want this to be a conversation, not me just rabbiting on, because I know I can.
We hope you're enjoying this episode of the Habits and Health podcast, where we believe that creating healthy habits should be easy. If you know a friend or a loved one who might be interested in learning simple habits to improve their health, then please share this podcast with them. We also invite you to subscribe and to leave us a review on your favorite podcast app. Now, back to the show.
Well, so one of the things I want to go back to is you talked about the addictive nature of the sugars and so on, and so in theory it's easy if people are able to switch to a ketogenic diet, a paleo-ketogenic diet, then the symptoms will go. But because of the addictive nature, many people aren't able to sustain that. So when people do struggle to try to switch, what are the best ways to help them?
Well, the answer is first of all, don't switch it for another addiction. The best example is stopping smoking. Very often people stop smoking and they swap nicotine addiction for sugar addiction, and they get fat. And we've all seen that in people who've given up smoking. I mean, the awful thing with addiction is there is no easy solution. And the shameful thing is addiction is how we deal with stress. So when we are stressed by something, we have unpleasant symptoms, and we use addiction to mask those symptoms. And it's short-term gain, long-term pain. And the awful thing is there is no easy, quick solution for that. It's just willpower. But what I can say is the longer that you can stick with it, the better. Now, all addictions, they are good servants, but bad masters. So I know I'm a potential alcohol addict. I love the stuff. But I don't drink at all at home. But if I have a party, if some friends come around, I have a couple of glasses of wine. And guess what? I'm much gigglier. I'm much funnier. My jokes are much better. We have a fun time. But I know I have to get on the wagon the day after. And it's the same with sugars. If you can consume sugars in a non-addictive way, use them occasionally, maybe as a flavour enhancer, use them occasionally for a jolly, but get off them routinely, then you'll be doing yourself a big favour. And I agree with you. There is no easy solution. It is willpower. People think if they pour money at it and take lots of supplements, they can get round it, but it just ain't like that. I wish I had an easy, you can do this and you'll feel much better, but it doesn't work. Even artificial sweeteners are a problem because, the body is intelligent. And if it tastes something sweet in the mouth, it will anticipate a sugar rush. It will pour out insulin in anticipation of that. And you will get all the metabolic problems of high insulin and high adrenaline following sweeteners because, as I say, the body is intelligent. So even they are not a good substitute. And that's why sweeteners have signally failed in people trying to do calorie-restricted diets. They don't work because, in fact, they just keep the addictive nature going.
You've mentioned about a couple of the books that you've written. How many books have you written?
Oh, gosh, 7 or 8 now, I think.
And so when was the last one?
The most recent one, which actually is due to come out any day now, is called Green Mother.
Okay.
And Green Mother is all about the application of ecological medicine to preconception care, pregnancy, child, the birth process, child rearing, weaning, sleep, and so on and so forth. And I don't laugh now, but I first wrote this book in 1982 when my daughter was born, and then it never got anywhere, and I got busy and rather forgot about it. And it just so happened that a neighbour moved in, lived the hill over there, became a very good friend and a soulmate, read my book on diabetes, immediately got the hang of that and put herself on a paleo-ketogenic diet. Now, Michelle and Pete have been trying for children for some time and failed. But within a few months of doing a PK diet and taking my supplements, Michelle conceived. So she continued the diet through her first pregnancy. Baby Bobs was born. And she continued the diet, PK diet, through breastfeeding, and has continued to wean, feed Bobs, and more recently, ETA number 2's come along, a paleo-ketogenic diet. Now, what's so fascinating about that is those children, they don't have any carbohydrates, so their blood sugar will be absolutely level. They're happily running on ketones. That means they never get hungry. That means they sleep. And both girls, from about the age of 12 weeks and earlier, go to bed at 7 o'clock in the evening and sleep through solidly till 8 o'clock the next morning. In fact, Michelle has to wake them up at 8 o'clock, otherwise they would continue to sleep. And in addition to that, they also sleep another 3 hours in the day. So Michelle has not had any nighttime. She's had her normal sleep routine. She can have an evening to herself because they're asleep by 7 o'clock. She says, I often get up early at 8 o'clock and go riding up at 5 o'clock in the morning and go for a ride because I know they're not going to wake up. And guess what? They never have. I think Etta's woken up twice, once when she had a tummy bug and once when she had a bat fly into the room and the bat woke her up. But Bob's has never woken up. And then she's a very talented artist, so she can continue to work in the afternoon because the children are asleep then. And those children, they're just so laid back. They're just so easy in all respects. I mean, when I go and stay, unfortunately, they've moved back to Dorset now. But, when I go and stay with them, I sit at the table and they're there too, and they're listening to the conversation, and they're not screaming and crying. And Michelle's quite tough with them. She wags a finger at them if they start to misbehave, and they just accept that. And they're just lovely, calm, healthy children, not being vaccinated. Yes, they get coughs and colds, but they get rid of them very rapidly with simple nutritional techniques. And they're not up and down, they're not shaky and tremulous. So they don't get hungry, they don't need snacks. They really are a different breed. So Green Mother is how we should be applying all this stuff. And of course, there's much in the book about the paleo-ketogenic diet to our children, because that's how primitive man raised his children, or rather primitive woman raised her children. Yeah, they ate exactly the same foods as the adults.
And so I gather then that approach means, because so many children now have asthma and various allergies and many other conditions, so that would address those sort of issues.
Of course. Prevention is far better than cure. And, we can link the rising rates of asthma directly to vaccination, because we know vaccines switch on allergy and switch on autoimmunity. But if you've got a healthy immune system, vaccines are rendered irrelevant. We just don't need them. In fact, I address that whole issue of vaccination in Green Mother and devote a whole chapter to that. Having acute febrile illness in childhood is very desirable. It trains the immune system. Children have been having acute febrile illnesses, since the start of the development of Homo sapiens, and they're an essential part of training the immune system. And if you've got good nutrition with vitamin D and vitamin C and all that, you will have no problem whatsoever from your mumps or your measles or your chicken pox. It doesn't matter. We should get all those infections. And the important thing is, getting those infections in childhood protects you from cancer and heart disease later on in life. Very clear associations between malignant brain tumours, for example. So it's part of normal growing up. It's part of the normal education of the immune system. And we should be educating our immune system with these infections. And we should be giving the immune systems the energy that it needs to fight. And we do that with the diet and good sleep, and the tools that it needs to fight. And we do that with good nutrition, a good, wholesome diet with lots of vitamin C and lots of vitamin D and B vitamins and selenium and zinc and all else. So I explain all that in Green Mother. And
so is that book out now?
I think it is out now. I'm not sure when it's certainly on my website. Because we started sending it out for Christmas because we knew people would want it for Christmas, but it's officially launched in the next day or two. But if you go to my website, you will certainly be able to get the book from there.
And for our overseas listeners, is it available on, say, Amazon and so on?
Yes. I'm not sure if Amazon have got it yet, but we send books overseas. I mean, unfortunately, the postage is a bit more, but I do have a lovely publisher in America called Chelsea Green, and they will stock that book for certain, and that will go out to the American and Canadian department. So it should be available, I hope, widely.
And speaking of books, is there a book in your life that you can think of that's really moved you for any particular reason?
I think probably Rachel Carson's Silent Spring, which I read in the early 1970s, when I was doing O-levels or A-levels. And that, to me, was a real eye-opener. I remember thinking, gosh, at that time, what we are doing to this planet is just not sustainable. In fact, the first book I wrote, I called Sustainable Medicine, or one of the early books. I've now replaced that with Ecological Medicine. But it made me realise that everything that we're doing in this world, every activity, is just not sustainable. It's just not compatible with a healthy world. And, of course, this sort of medicine I'm practicing now, ecological medicine, functional medicine, sustainable medicine, naturopathic medicine, it doesn't matter what we call it. The point is, it is all done in accordance with the rules of nature. And that's very empowering because, by practicing this medicine, everybody has, as I call it, the rules of the game and the tools of the trade to heal themselves. And it all started with Rachel Carson, bless her.
If people want to find more about you, Sarah, where's the best places to look? Website, social media, so on?
Well, if you just go to Dr. Myhill, my website, most of my information is there, freely available on my website. Some people prefer books, and all my books are there, and there's a whole range of them. There's the infection game, there's the energy equation, which looks specifically about those issues. And what has proved very popular is I run all workshops, and anybody can join them. You can buy a ticket, and then you get me talking all day from 9:30 in the morning to 4 o'clock in the afternoon with a break for lunch. And I limit it to 20 people. And at any point, anybody can ask any question by just waving their hand. And I go through all these regimes that people need to do to empower themselves, to allow them to heal themselves, because there aren't enough functional doctors like you and me around to do this individually. And actually, they do work remarkably well. And if people don't get a response to that early, then there are follow-up workshops that I do where I limit that to 6 people, and we more intensively concentrate on individual people's symptoms. And I do it in groups like that because we can cover so much more ground. And people learn by repetition. Of course, it's all recorded, so you can then listen to that subsequently. But people learn by repetition, and when they see that they're not the only person in the world, there are other people like them who have similar problems and similar questions and the same answers. That's hugely empowering. So that'd be a useful start for somebody who really wanted to move things on inexpensively.
Sarah, just before we finish, and it's been a delight, but I have to be respectful of your time. Is there a quotation you particularly like?
I am a great fan of Winston Churchill. I've just been reading his biography again. And in that, Churchill says, "My education was only interrupted by my schooling." And I think that's wonderful, because schooling at the moment at schools, and dare I say it, medical education, is not an education, it's a brainwashing. And I reckon I use in my everyday practice maybe 5% or less of that I learned at medical school. 95% of what I practice, I have learned since, from books, from people like you, from my patients, from asking the right questions. So what I would say to people is, there's so much information available, and you can educate yourself, and that's an essential part of recovery and getting well. So don't rely on traditional, schoolings, which are brainwashings. Use the resources that are available to educate yourself, to learn it for yourself, and then work it out. And that's what Winston Churchill did.
Sarah, it's been fascinating. So I really appreciate your time. So thank you very much. My
pleasure. It's easy when you have a good interviewer like you who asks all the right questions.
Next week, episode 50. And my guest is Silke Maria Haas. She is an energetic coach and a healer who has more than 25 years of experience helping people with physical, emotional, mental and spiritual problems. And being a natural seeker of truth, she went to India at the age of 18 and discovered yoga as a way of life. And from that, she's been helping many students with medical problems. She trained as an osteopath and a naturopath. And so we hear a lot more about that journey and what's happened since then and how she helps people now. So that's next week, episode 50 with Silke Maria Haas. If you enjoyed this week's episode with Sarah Myhill, please do share the episode with anyone who you feel will get some real values, get some real benefit from it, and hope you have a great week.
Thanks for tuning in to the Habits and Health Podcast, where we believe creating healthy habits should be easy. If you enjoyed this episode, please subscribe and leave us a review on your favorite podcast app. Sign up for email updates and learn about coaching and workshop opportunities at tonywinyard.com. See you next time on the Habits and Health Podcast.